Hey, hey.
Hello.
Hi. So today we're going to be talking about the most common cause of muscular lower back pain.
Yeah.
And can you believe it? But it's estimated that 65 million Americans deal with back pain. Yeah. So if
That's a
that's you,
lot.
you're not alone.
Yep, you're not alone.
So hi, we're Brian and Christina from Your HealthySteps, and we're the creators of the Ultimate Foam Roller Blueprint. And we teach you purposeful foam rolling and self-care
Absolutely.
skills so you can stay active and pain-free. So we've been massage therapists for the past 15 years, and so we're sharing information that we would share with our clients, and we're going to share it with you too, because it's all about helping yourself, right?
Yep, self-advocacy and self-care.
Stay pain-free, yes. Okay.
Okay, our cat is on the table with her feet all over the computer.
Here he is, yep.
Okay.
Okay. So I'm sorry. So there's lots of reasons for muscular back pain. And so what we're going to focus on is muscular. That's our thing, is muscles. So we're going to share about the reasons why you can have lower back pain that's caused by muscles. Okay,
Yep.
that's it. And today we're talking about this muscle in orange called the Quadratus Lumborum, or also known as the QL.
QL, yeah.
Okay, your story.
So my story is that I've had lower back problems well before we were dating, honestly, and mainly because I did manual labor when I was younger. I worked on a farm. I just did a lot of physical work, and then I eventually became a truck driver for a while in the military. I was also a forklift operator, but it was always heavy moving flatbed stuff and moving chains and that kind of stuff. And I just really beat up my back. I mean, there's just no other way around it. And this muscle was the primary cause of a lot of my muscular pain. So luckily I didn't have any back injury. It was really more severe spasms. In fact, all the symptoms we talk about today, I experienced. In fact, one time I was dating, actually I think we were just recently married, and I bent over to pick up a piece of paper she had dropped at her office, and then went right into massive spasm, and basically they just turned the lights off and left me in the floor until I could, because it was so painful. I didn't want anybody to touch me. I'm surprised nobody called an ambulance, but anyways, it got better, and I was able to get up and walk out with a degree of dignity. But it was bad. It was very bad.
Yeah.
So let's talk about, do you want to do the location?
Yeah, sure.
Okay, excellent.
Okay. So your QL, or Quadratus Lumborum, is found in your lower back, and here it is. So it really is the shape of a rectangle. It attaches on your last rib, and then it attaches on a few of the lumbar vertebrae. And then down here, it attaches on the top of your hip bone. So if you were to touch your own QL, the way you would find it is you're going to take your hand and just put it on your hip. And where your fingers lay, your four fingers, is pretty much right here.
If Mr. Manny put his hands on the hip like this, his fingers would rest right on the QL.
Right.
So that's a great word. Now there's other stuff there.
Right.
But yes, I mean that's the location of the QL.
There's a lot of muscles in this area. So for us to say that you could just feel that QL is, you can't.
You can.
But that's where that QL is. So if you're, like Brian's going to talk about, some of the pain, perhaps this might be a cue for you to know that it's this QL.
Yeah.
Okay.
So what does this muscle do? Well, because of its location, it's a great muscle for what we call, actually its nickname is hip hiker, because it can actually pull the hip up on one side. So if this side is really tight, literally one side of Manny's hip, or his right side hip, might be higher, or the left side might be higher. And because, again, where it's located at, it helps us bend at the side. So if Mr. Manny was bending to the side to his right, this muscle would be part of that. There's other muscles that are doing it, but this is one of them. And if he went to the left, this side would be working to help him bend to the left. And then if Mr. Manny bent forward, say to touch his toes or stretch his hamstrings, and as he came back up, the Quadratus Lumborum would be another one of those muscles that helps him stand erect. We call this extension of the spine. And then because of its location on the rib cage, they work together. They really kind of help stabilize and hold that rib down as we breathe. So it's got a pretty important job. But really where this muscle comes into play is when it gets angry and it gets tighter and tighter and tighter, and it becomes to develop trigger points. And this muscle here has 4 trigger points that it can develop. And we're going to talk about a whole host of symptoms, because this is definitely a bad muscle to make mad. It really is. It's not a muscle we want to play around with, because one of its symptoms is lower back pain, but it's also a persistent, deep, achy pain that no matter what position you're in, it's just always there. It's just this deep ache pain that can actually go from deep to sort of this persistent kind of dull pain to severe pain, and then any little movement you do takes it right into excruciating pain. And it doesn't really seem to matter. I mean, when this muscle gets really angry and fired up, you don't want to bend forward. You don't want to bend to the side. You don't even want to turn. Sitting is painful.
So you're
Standing
saying you
is
don't want to
painful.
do all those motions because it hurts.
Yes, because the pain, yes. And it's not only just a hurt, it's actually what I experienced and what other people have told me is it's a stabbing knife pain. Like if somebody had just took a huge knife and stabbed you right in the lower back. And it's immediately, you stop whatever you're doing, and even breathing can be painful. Just that making the ribs do a little bit of work can cause this thing to fire off. So again, any movement that QL would be involved in, you don't want to do because it's that painful. And again, climbing stairs, just really movement. In fact, people have been known, like that one where, I mean, literally I was on my hands and knees, and all I wanted to do was try to get on the floor somehow and just lay there and not move. I didn't want to move at all, but getting to the floor, and even from my hands and knees to the floor to lay down was so excruciating. Like it seemed like hours to take me to get to the floor. So again, that's how bad this thing is. And it can be very persistent and so painful that it actually can invoke depression. People just get so depressed because it just doesn't seem to want to go away. And it's so debilitating. So again, it's a really nasty muscle to have angry. So that's just the lower back issues. We're not even talking about the referral pain. And again, a trigger point is when a muscle gets so angry, it sends pain off somewhere else. And this muscle does exactly the same thing. So what we're going to do here is we're going to be covering up Mr. Manny, because we're going to show one side of Mr. Manny's rear end. Let's see if we can do this here. Because again, this muscle can fire off some pain. So let's see if we can do that.
There we go.
So this referral pain can send pain down into the sacrum, just right off the sacrum, pretty much anywhere in the gluteus maximus, even down here at what we call the gluteal fold, you can have pain, and pain from that gluteal fold over to the side of the leg, all the way over to the side. And up here, you can get pain all the way across the hip, where the ridge of the hip is, down the front, and down into the groins, and even into the abdominal. You can get pain from this trigger point. So that's a lot.
That's a lot of
just a lot of trigger points, and a lot of just lower back pain. So again, this is definitely not a muscle we want to mess around with. And we are big fans of prevention. So
right. So
hopefully he's decent.
As massage therapists, we are very concerned about draping.
Yes.
As you can tell.
Well,
he's a mannequin.
He's a mannequin.
Still, we're being thoughtful of Mr. Manny.
Mr. Manny, yeah.
So I just want you to know that if you go to get a massage done, right, and it's your QL that's bothering you, even though you might have all those red marks, the pain might be in your rear.
Yeah.
Most massage therapists are going to work through the sheet.
The QL.
So please don't even be concerned that your rear is going to be exposed. But how else can we show you these trigger point patterns if we weren't showing you his rear?
Right.
He's a mannequin.
He's a mannequin.
So it's not that big of a deal.
So
yeah, go ahead.
But we wanted to drape him anyways, because it's just a sign of, because we want, this is how probably, you're right. If you were going in, they would be working up here anyways. But a lot of times if you have pain down here, they may go in here and just check and see if there is a cause down here for pain, because some muscles do refer to the glutes. But again, you're going to be draped. A lot of people now, a lot of therapists don't even, they work right through the shorts, that you don't even have to take your shorts off. So I think that's fantastic.
Right.
So yeah, don't let that don't allow that to cause you not to go in and seek help.
Yes.
Because again, this muscle, it can start off just slightly painful and tight, but then when it gets angry, you will be going in for some kind of therapy, because it's brutal. It's brutal.
Okay. So are you done? I guess you are.
All done.
You wrapped them up.
Wrapped them up.
Okay, so if you have a muscular pain problem that you can't figure out,
Absolutely.
then please send us a question. We love researching and finding out what the pain pattern could be, what muscle could be creating that.
Yeah, I mean, even though this is one that I've dealt with, a lot of our clients have talked about this one.
Yes.
And have done the same thing where they were on the floor in spasm and scared,
Yes.
really terrified that something horrifyingly bad was going on, right?
Yeah. So if you've experienced that, if you know exactly what Brian is talking about, or if you're like, gosh, darn it, my muscles are so tight, you're having lower back pain, then you need to start our 3-day program,
yes.
which is called, it's the first 3 steps to a more flexible and pain-free body. And it's going to walk you through 9 days of things that you can do yourself to help reduce this muscular pain.
Yeah, start the movement.
Okay.
For a flexible body. Yeah.
Yeah, so I will put the link below for you. And again, if you have questions, go ahead.
And tomorrow we're going to cover the self-care of this muscle and how to help keep it looser and more flexible. So
yes.
you don't run into this problem.
You definitely want to follow the link to the second video, which we'll put tomorrow, that shows you self-care for this muscle.
Absolutely.
Okay, thanks so much. We'll see you later.
All right, have a great day.